Deputy Administrator, we're glad that you're here. How long have you been in this role?
I have been in this role since January of last year.
And you were there in the Trump administration in a similar role.
This is my third tour at CMS.
Yeah. You seem very knowledgeable about this. I appreciate that. I want to talk about my own home state of Texas. And in Texas, $65 million was paid in fraudulent Medicare claims related to genetic testing that was never even requested on behalf of the beneficiaries. It seems like you're aware of that. Have you observed to their lab schemes that's involving fraudulent or unnecessary lab testing? How do you get to that? What's the process?
It's very difficult, sir, and we have observed it. In fact, as I mentioned to you with our fraud detection war room that we have, the $1.8 billion we stopped last year, $100 million plus of it was related to just those types of laboratory services. And unfortunately, what that means is then when those services get billed, even if they're not provided, they go on the patient's medical record, and it precludes them from being able to get that type of testing in the future when they might need it for a cancer diagnosis or something more serious.
So our great citizens are the brunt of that, really, while the thieves are making away with the taxpayer dollars.
Correct.
I appreciate what y'all are doing. Programs like Medicare and Medicaid are designed, as we would say, for the most vulnerable populations in our country, such as the elderly. These populations are also the most given to healthcare scams, as you well know. Given the essential role CMS plays in our healthcare system, how do you educate some of those elderly population to stay away from those scams?
It's a great question, something we are continuing to work even more on. Right now, we have several different things. We've been doing various videos that Dr. Oz has been posting, telling people if you see something, say something. Call 1-800-HHS-TIPS. Call 1-800-Medicare. Contact your senior Medicare patrol. The hospice fraud that we've been looking at in Los Angeles, a big part of how we've been able to really successfully go after it is because we are partnering with the state officials for the senior Medicare patrol and for the organizations that are protecting Medicare and Medicaid beneficiaries in LA and really using them to help us identify where this fraud is occurring and to then educate their members and the beneficiaries they serve about what to do. It's really important to us that seniors understand that they should not fall victim to these schemes or give their information out to people. It's when they do that these types of harms occur.
Well, your lips to God's ears. I appreciate y'all doing it. This, just to me, I'm just a simple guy. I owned an air conditioning company business for 35 years, but math I can do. Seems like you ought to go to the states and you ought to say which ones are the first you're going to look at. You look at the number of the population, look at the number of the Medicaid. I'm talking about the whole population in the state, the Medicaid recipients, the amount of federal and state tax dollars being spent, or Medicaid dollars, and then the method of recovering, if any, of the fraudulent dollars. CMS claims by state, so identify the first state. Are you doing that? Are you giving states priority to those you have the most amount of fraud in said state? How do you do that?
It's a combination of things, as we mentioned, or as I mentioned earlier, we really do use a data-driven approach. For instance, some of our recent actions, which led to the letter to New York State, was because in New York, what we found was that their spending for Medicaid beneficiaries was 36% higher than the national average. And we were trying to get a better sense of why that is, particularly because of the fact there were several particularly fraudulent types of services, such as adult daycares, which seem to be funneling a lot of these dollars away from legitimate
Next thing
services.
you know, you'll have daycares in Minnesota that get paid millions and millions of dollars for keeping care of kids, and they don't. Did I say that out loud?
And they also have autism services where there were kickbacks of several $1,000s paid to patients or to parents for bringing their children in to claim they had autism and to seek those services, which were never provided.
So how do you? And so when you say New York was 36% higher than the other
Yeah,
states.
the average spending on each beneficiary for New York Medicaid is 36% higher than the national average.
Did they seem willing to work with you and to find out why that is?
Well, that is why we sent them a letter, and we are hoping to get a response so that we can better understand, using the information they provide, why that's happening. I will say with Minnesota, we've been able to come to a much better understanding of what some of the issues were that drove that spike in spending, and we're working with the state to hopefully get better program integrity safeguards.
Yeah, well, there's a lot of waste, fraud, and abuse out there, isn't it? And
There
our-
is. It's not just out and out fraud. There's also a lot of waste, people billing for services that at a higher level than necessary. There's also a lot of abuse in that people are just taking advantage and billing for things that just aren't necessary at all. And then that puts beneficiaries at harm too.
Well, thank you. Our most vulnerable Americans are paying that price, aren't they? Mr. Chairman, I yield back.